that this session today I'd like to acknowledge that this session today is occurring on the shared, unceded, ancestral, and traditional homelands of the Musqueam, Squamish, and Tsleil-Waututh people. We're very fortunate to have Dr. Danièle Behn-Smith, Dr. Kate Jongbloed, and Kirsten White joining us today as our guest speakers. As usual, we want to start this session with a wonderful opening by Elder Glyda. She has always put us in wonderful space and in the right mind and the nice space for the learning. And so I absolutely want to right now pass it over to Elder Glyda. Again, Elder Glyda, thank you so much for joining us. I pass this time over to you.
Good morning, everyone. Just giving a warm welcome to each of you. It's so wonderful to be here for the VCH Indigenous Health Round. Looking forward to hearing all of the speakers. This topic is so important. Before I begin, I'll introduce myself briefly. I'm Elder Glyda Morgan from the Tla'amin Nation, my mother's people, always honoring my life giver, and so grateful to always remember her in a good way. Also honoring my late father, was born in Church House, BC, mouth of Butte Inlet, relocated to Campbell River. Always inviting in our ancestors to our sacred circle here and remembering our children, our grandchildren, our great-grandchildren, and those yet to be born. That's why I'm so honored to be able to be here and do this work. So I invite you all, plant your feet on the floor, going right through down to our first Holy Mother Earth, hearing the beating of your heart, hearing my voice, and listening to the sound of the rattle as I sing this song taught to me by my beautiful niece, Brenda Hansen. We are the children of the world. We are the flowers in the sky. We are the hope of tomorrow. Hey, children of the world. Oh, 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 okay. We are the children of the world. Just inviting you, each and every one in our sacred circle, to pray in your own way. Inviting in the grandmothers, the great-grandmothers, the grandfathers, and the great-grandfathers. Asking for blessings for each person here, and for their families, for their colleagues. Asking for prayers for all our sacred animals, the ones that fly and the ones that swim in our oceans, rivers, and lakes, for the two-leggeds and the four-leggeds, and for the ones that crawl upon our first Holy Mother Earth. Prayers for them. Asking for prayers for the ones that are struggling. Creator, take care of them with all of the challenges that we face today. Asking for special prayers for all of our missing and murdered Indigenous women, girls, two-spirit plus, boys and men. Prayers for their spirits and for their families. Also, prayers for the recovered spirits that began in Schwebnik territory, Kamloops. Prayers for the families and for the recovered spirits that began 215 and is over 10,000. It's gone right across Canada. And asking for blessings for the spirits and for the families, Creator. I'm asking for prayers for the ones that are struggling, for the ones that are unhoused and the ones without nourishment, and for all of the ones in our hospitals and all of the institutions of the prisons. I'm asking for special blessings for all the ones that are doing the best that they can, Creator, from across all the four directions. And today I'm asking for prayers of peace. I'm asking for blessings for the ones that have gone through the floods and the fires, and especially again prayers of peace for the struggles that we're facing in the Middle East and all around Turtle Island, asking for prayers of peace. And again, I'm bringing it back to our sacred circle as we begin in a good way. Blessings to each of you, from my heart to yours, all my relations, Emot Squagan, Haichka, OCM, thank you. Emote, thank you so much. Thank you. Back to you.
Thank you, Elder Glyda. Thank you so much for your prayer, your song, and your words. Really place our minds to open our minds up and also soften our hearts for the message today. So really appreciate that a lot. Really welcome everyone here. For those who don't know me, I'd love to get to know you. My name is Kendall Ho. I'm an emergency physician in Vancouver. I'm a settler here in the traditional and ceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. You are very welcome. Please, if you'd like to do line acknowledgement, please use the chat functions so that you can share your line acknowledgement there. And I'd love to get to know you both through the chats and throughout discussion period. So today's session, we will be having our three speakers looking at unlearning and undoing white supremacy and Indigenous-specific racism. Let me first acknowledge that the organization of this round, I really want to appreciate the collaboration with BC Ministry of Health, Patients as Partners program, with the Vancouver Coastal Health, Indigenous Health, with Vancouver Physician Staff Association, and also the Engaging Physicians in Indigenous Cultural Safety Task Group in Vancouver Physician Staff Association that work together. We're very grateful for the foundational support of the BC Ministry of Health Patients as Partners initiative, with whom we've developed a long-standing relationship over the last 10 years and moving into 11 years now after this round in advancing person and family-centered care. The Ministry of Health continues to advance this shared journey of reconciliation, apply equity and anti-racism approaches, and address systemic racism in the health system. This is recognized in the Ministry of Health's mandate letter that states that ministry will continue working towards true and meaningful reconciliation by supporting opportunities for Indigenous peoples to be full partners in the inclusive and sustainable province we're building together. In this work, the Ministry of Health continues to address recommendations from the Truth and Reconciliation Commission of Canada's Call for Action, UNDRIP, and in Plain Sight report. For more information, please visit patientsaspartners.ca to find other organizations who offer free events and resources on person and family-centered care, chronic disease self-management, and caregiver support. I very much would like to also acknowledge our partners in Vancouver Coastal Health, Indigenous Health. VCH plays a critical role in upholding the Declaration of the Rights of Indigenous Peoples Act, DRIPA, the Truth and Reconciliation Commissions of Canada, TRC, Call for Action, and in implementing the 24 recommendations of the Plain Sight report. Together, we're committed to celebrating Indigenous ways of knowing and being, to acknowledging the strength and courage demonstrated while enduring generations of atrocities. I would also like to acknowledge the support of First Nations Health Authority with their participation in these plannings and a tremendous opportunity for us to learn from First Nations Health Authority and working together in this province. And I would also like to acknowledge the support of Vancouver Physician Staff Association as we work together to engage the physician community together with our interprofessional community here to build a more collaborative, inclusive, and caring community to support the best patient care as well as First Nations Health Authority together. With this, I am delighted to be able to now introduce our three speakers. I will name them, and they will also be introducing themselves. I'd like to acknowledge that Dr. Danièle Behn-Smith is the Deputy Provincial Health Officer of Indigenous Health at the BC Office of the Provincial Health Officer. Dr. Kate Jongbloed is a Senior Scientist at the BC Centre for Disease Control, and Kirsten is a registered nurse living on the unceded traditional territories of the Squamish First Nations. Maybe I'll now take the time to pass it over, and maybe I'll start with Dr. Danièle Behn-Smith. Let me pass it over to you. And again, thank you, the three of you, for being here to share your thoughts and lessons with us. Thank you.
Masicho, Marcy, Dr. Ho, and the ICON team for getting us here today and inviting us. Tanche Kiawau, Selot Siet Nezu Nekandeta, Danièle Behn Smith Dishnakashan, Sezitla Azezon, and Michif, Shten Michif, Pi Echodene At E, Fort Nelson First Nation, Gods E At E, Pi Winnipeg Doschin, Anush Lequangentanach Niwikin, Pi Niminiquan di Lo de Tsauk Nation. Good morning. Oh, good afternoon. I'm going to catch myself what time of day it is. My name's Danièle, and it's a distinct pleasure to be able to introduce myself using a teeny tiny bit of my languages. I just told you my name. My Slavey name is Azezon, which means crying all the time. I told you that I'm Echo Dene from Fort Nelson First Nation. That's through my dad. I'm also Red River Métis from the Red River Valley. That's through my mom. I live in Lekwungen on Lekwungen Tanach. That's where I'm calling in from today. And I was acknowledging that my drinking water comes from Tsauk Nation. I'm cisgendered, straight. I use she, her pronouns, and I'm a mom to 2 kiddos. And as Dr. Ho mentioned, I'm also BC's Deputy Provincial Health Officer for Indigenous Health. So I'm very grateful that I get to serve in that role. And I'm joined today by my 2 awesome colleagues, Kate and Kirsten. So I will pass it over to you, Kate.
Hi, good afternoon, everyone. My name is Kate Jongbloed. I'm a white lady. I'm an occupier on Musqueam territory, but today I'm calling in from Treaty 6 territory. I am an epidemiologist and a mixed methods health researcher, and I work at the BC Centre for Disease Control. Danièle and I together are the co-principal investigators of the Unlearning and Undoing White Supremacy and Indigenous-Specific Racism Lab for Population and Public Health, the UNU lab, and we'll talk a little bit more about that later. And I am a she, her kind of human. Danièle, the slides are there.
Huh, I don't see them, so that might be tricky for my job as person advancing the slides. Can somebody else do that for me, please?
Yes, and I'll
Thank
pass
you.
it to Kirsten.
Hi, everyone. I'm Kirsten. I'm calling in from the unceded traditional territories of the Comox First Nation, where I am a white occupier. I use she, her pronouns. I'm queer, and I'm a registered nurse. I've been working mostly for the last a little bit over 13 years as mostly the emergency departments of northern Manitoba, lower mainland, and then now most recently on Vancouver Island, as well as in remote and northern Indigenous communities in the Northwest Territories, and most recently for the Nisga'a Nation. And it's really nice to be with you all. I'm going to get us started off because it's always our practice to acknowledge the lands that we currently occupy in what's now known as British Columbia. And so the land frames the basis for our work. And acknowledging the inherent rights and titles of the First Nations on these territories, we endeavor to honor the teachings that come from the land through our work. So we acknowledge that First Nations territories stretch to every inch of this province. Inherent rights that are rooted in connection to lands and waters have never been ceded or surrendered here. And long-standing Indigenous laws and systems are integrally tied to these lands and waters of these territories. And these inherent rights are upheld in international, national, and provincial law, as well as generations of Indigenous rights holders who are First Nations, Métis, and Inuit from elsewhere in Canada also call these lands and waters home. So all of these humans have the inherent rights to health and wellness. BC First Nations and Indigenous people from elsewhere in Canada, as I mentioned, Métis, Inuit, and First Nations from elsewhere. And this is just some examples of colonial and settler obligations under international, national, and provincial law to change the way that we've been doing things, and we'll get into them a little bit more later in this talk as well. And then another key part of our inherent rights and land acknowledgement is speaking to the interconnectedness of health, and that includes speaking the truth, which is the eat, and that's a Coast Salish law gifted to us to our provincial health authority by knowledge keeper Tete and Shane Point. So this truth that the toxic drug poisoning crisis impacts First Nations peoples in BC at a drastically higher rate than settler populations. And this has led to the heartbreaking decrease in life expectancy that's been reported by the First Nations Health Authority. So death due to toxic drug poisoning is over 9 times higher among First Nations women in BC compared to non-Indigenous women. And then you can flip it back to the next slide, Kate, and take it over from there.
Okay, sorry, I created a confusion. So I will advance the slides, and apologies, that was just a misclick that it went, and I didn't want to confuse things, but now everybody's welcome to the way that we work. It's a little bit loosey-goosey sometimes. We're just figuring it out from a distance. So, and we understand that a lot of folks are going to have to leave at 1 o'clock. You're here on your lunch hour, so thank you for spending your lunch hour with us. We're going to speak very quickly, and sometimes we have lots of different tangents and stories we tell, but today we're going to try and be pretty disciplined about getting through the deck. So just briefly, our lab exists, and we are working to unlearn and undo white supremacy and Indigenous-specific racism, and that's what we're going to tell you about today. We're going to do a bit of a 3-2-2-1. So we're going to share 3 frameworks, 2 metaphors. Actually, I think we're only going to do 1 piece of research and 1 tool. So it's a 3-2-1-1. And this is a QR code that can bring you to a little bit more depth and understanding of our work. And so these are the 3 frameworks. When Kate and I started this work together back in 2021, we really didn't know exactly how one goes about unlearning and undoing white supremacy. So we looked to the brilliance of Dr. Kamara Jones, who's a Black American public health physician, and her science and practice of anti-racism framework. So she tells us to name racism, ask how it's operating here, and organize and strategize to act. And so we got busy with that. As we were doing the work, Puglas Jody Wilson-Raybould published her True Reconciliation Framework, or her True Reconciliation book, which includes a framework with 3 core practices, which include learn, understand, and act. And we saw those as mapping really well to Dr. Kamara Jones's teachings. And so we layered those in, and we've purposely put them in this circle because we are constantly going around and around and around. And sometimes we can't make it all the way to act, but the important first steps of naming and learn always stand. And more recently, we have also layered in the BC Ministers Advisory Council on Indigenous Women, Indigenous Gender-Based Analysis Plus Toolkit. So we encourage people to have a look there. We look primarily through the lenses of settler colonialism, white supremacy, and Indigenous-specific racism. And we know that there are many other systems of oppression that create harms and make certain groups vulnerable. And so we are trying to think and act intersectionally, and this tool really helps us do that. I'm awkwardly stumbling over my words because I'm trying not to go on a tangent, but I'm going to do it anyway to tell everybody that I believe that Jody Wilson-Raybould is my best friend, but we've never met. And recently I've learned that through family connections, we're like kind of cousins. So now I want to tell everybody that she's both my best friend and my cousin who I've never met. Okay, so I've broken my rule of no tangents. This is another person who guides me on a daily basis, Dr. Becky Kennedy, who is a white lady clinical psychologist that lives in New York. And I joined her group, her community in 2021 to help me in my parenting. And lo and behold, it's very, very helpful also in the work of eradicating Indigenous-specific racism and advancing true reconciliation. So Dr. Becky tells us discomfort is a sign that you're doing something new, not that you're doing something wrong. This work is by its very nature deeply uncomfortable. And so again, thank you for coming to spend your lunch hour, which is about rest and recuperation and restoration, and coming to the space to talk about white supremacy, which is uncomfortable. So honoring that and just inviting you to read that signal as a win, that you're on the right path of doing something new, not something wrong. Oh, I clicked the slide. There really is a lag. One more click.
Oh,
Okay.
we Danielle said, go through this, learn, understand, act over and over again. And so we're going to do that with you today. And this is our first metaphor. It's one that we found so useful in helping the human beings, especially the settler human beings and the occupier human beings, understand what we're talking about. So we use a metaphor of a net to understand settler colonialism. And you might think of these giant lines that are holding this enormous installation that was actually 3,500 pounds, 860,000 individual knots over Coast Salish territory at Canada Place in 2014. These big lines for me represent those big structures of settler colonialism, like the reserve system, the Indian Act, the residential school system. But then this net that impedes First Nations people from those fully lived rights and title that Kirsten just talked about. Is made up in much finer detail by individual colonial knots. And those could be like the policies, the guidelines, the day-to-day decisions that we make that actually keeps this settler colonial system intact. And these pictures here on the side really reflect that. For me, as a settler, standing on the sidelines, I'm not subject to the Indian Act or the reserve system. And many times this net is almost invisible to me. And then there are other moments where it briefly becomes so vivid, like when the 215 missing children were identified as Elder Glida talked about, and the earth shakes beneath us, and we're like, oh my God, what can we do? Those of us in the caring professions, we've come because we really care about the health and well-being of all people. But then that the news cycle changes, our attention sort of reduces, we go back to our regular scheduled programming, and maybe our eyes are not on this. And so for me, what really is highlighted that each of us working in the health system, from the most junior person to the most senior person, we create and recreate the health system on a day-to-day basis. And our job is to know what are the colonial knots in our sphere of control and our sphere of influence, and what have we been told by First Nations, Inuit, and Métis people about how to untie them.
Thanks, Kate. And Masi Cho, because I was a bit thrown by the slides, and then I realized just now that I didn't say Masi Cho to Elder Glida for that beautiful opening. And thank you so much for that. And maybe it was because it's an opportunity to model that this work is messy, it's imperfect, we make mistakes, and that's okay. Naming them can be really helpful. And it really struck me when Elder Glida, when you were doing your opening, and yeah, specifically talking about the missing children, how that's such heavy, hard heart work. And as Kate just mentioned, we feel quite powerless. Like we weren't there at that time. So, we can't do anything in that historical moment, but there are absolutely things that each and every one of us can do today to be a part of making things right and honoring the lives of those missing and also other descendants and survivors. So thank you so much for that. And so we're going to pause for a moment just to talk about the language of whiteness and white supremacy, which can be quite evocative and provocative. And so we want to take a moment to explain exactly what it is that we mean by it when we use those terms. And we find this painting from Kent Monkman really helpful to do that. So Kent Monkman is a Cree artist who created this painting that's called The Daddies. And this is a recreation of an original Robert Harris painting called The Fathers of Confederation. The original painting was commissioned by Ottawa to celebrate and honor the Charlottetown Conference, which was one of 3 conferences that ultimately led to the Confederacy of Canada. And what caught Kent Monkman's attention when he was looking at the original painting was an empty footstool in the foreground. And he's taken the opportunity to put his alter ego, Mischief Eagle Testicle, right there in the front, and doing that to draw attention to the fact that as First Nations, Métis, and Inuit people, we were excluded from that very important moment in Canadian history. And we were excluded due to epistemological differences and the widely held belief at that time that non-Indigenous people were far superior to Indigenous people. And in fact, we weren't even regarded as people at all at that time. We were regarded as savage and uncivilized. And so this is a really helpful image. I think, especially if we fast forward to this moment in time where this is no longer a widely held belief. So the ideology of white supremacy has been rejected, quite a large scale, although not totally eradicated. But what's really interesting is that even though most of us, and I would argue probably the roughly 200 of us that are gathered here today, there's probably nobody in our circle today that holds a personal belief that white people are superior to other people. And yet, we can pick any outcome that we want, any indicator. We can pick housing, we can pick life expectancy, we can pick education. And we know that this comes out in our data. And we actually also see it on other income or other outcomes, including leadership. And so then we're left holding this tension because on the one hand, we reject the idea that there's something inherent about predominantly white men, as an example here, that makes them more suited or more capable to hold positions of power and positions of leadership. And yet, this is the truth of what endures. And so the other way to make sense of this is to understand that although that ideology of white supremacy is not something that we hold as individuals now, it continues to inform our systems, our structures, our policies, and our practices in ways that continue to confer an unearned advantage on a narrow segment of the population and unearned disadvantage on many others. And so I'm just waiting for the slide to advance. Kate, did you want to speak to these next slides?
Yeah, and so one of the things that is so clear to me is that we have really clear obligations to change that image, like to shift every indicator to eradicate those disparities that are rooted in white supremacy. And so those obligations come from very clear instructions within our treaties, in the Canadian Constitution, in court rulings, in the federal UN Declaration on the Rights of Indigenous Peoples law, the provincial one, stated commitments by our governments, and also we also have been given a very, very clear framework to anchor this work on. The Truth and Reconciliation Commission called UNDRIP the Framework for Reconciliation. And then we've received over 1,000 very clear and what Danièle calls life-saving instructions about that correspond to each of our work. Like for TRC, there's 7 calls to action related to health, and none of them have been completed in the 10 years since the TRC came out. And we put them here with these check marks along the bottom, because for me, that's a reminder that all this work to put those structures and frameworks into place is work that was done by First Nations, Inuit, and Métis people that was resisted in many ways by the settler government. And so this is where we get to that orange box, that implementation box that requires us as settlers to step into that relational accountability with First Nations, Inuit, and Métis people and do every day in every way do our part.
Thanks, Kate. we went forward too many. There we go. So one of the light bulb moments that came to us in doing this work that I found so helpful is this metaphor that we use of birch bark baskets and copper pots. And this really helps us to unpack and see more clearly that there are separate baskets or buckets of work that need to be undertaken in order to action and in order to advance true reconciliation. And for me, anyway, for a long time, this term of Indigenous health was unhelpful or is unhelpful because it kind of keeps all of the separate pieces of work jumbled up together, and it becomes a little bit more difficult to understand what work and whose work. So we use this metaphor to understand that the work of First Nations, Inuit, and Métis peoples to advance our own health and wellness is our own, and we use this birch bark basket that comes from Treaty 8 territory to symbolize that. And so that is the work of reclaiming and revitalizing our languages, our ceremonies, our practices, carrying out our rights and responsibilities to our lands and waters and our more than human relatives. And so this is very heavy, hard heart work. It's the work of recovering from attempted genocide and intergenerational healing. And that's work that only we can do with and for each other. On the other side of the screen, we have a copper pot that comes from Kate's Great Opa's machine shop in Holland. It sits on her in her office on unceded Musqueam territory, and we use this to represent the work of settlers. And this is also heavy, hard heart work. And it is the work of eradicating and dismantling the white supremacy and Indigenous-specific racism that's been created by settlers and continues to be perpetuated in settler organizations. We've received a very, very beautiful teaching from Elder Phyllis Williams from Curve Lake First Nation, who's Anishinaabe, and she has shared with us that copper pots and copper bowls are regarded as sacred in Anishinaabe culture because of their healing and purifying properties. And she's given us permission to share that when we're talking about this metaphor. And for me, that adds such a beautiful layer to this because it reminds us that these occupied territories that make up Turtle Island hold sacred knowledge and beautiful teachings and laws that can actually hold all of this messy, hard heart work in these really beautiful healing ways if we take the time to acknowledge that and affirm that. Okay, next slide. The next section we're going in, so now we've done 3 frameworks, 2 metaphors, and we're going to tell you about one piece of research, and we're going to do it really quickly. And Kate's going to do it in the turbo mode.
So moving into this understand, and I shared before, we have these really clear life-saving instructions. But we were noticing that maybe we're not really disciplined to checking in with ourselves about how we're doing on these. And so when I started doing my postdoc at the Office of the Provincial Health Officer in 2021, we decided that we were going to check in every 6 months about all of our colleagues and ourselves, our engagement with these really important life-saving instructions or these foundational obligations. So we asked our colleagues to rank, I'll just go back one for a second, Danièle, to rank their engagement with these. And then we also asked them to reflect, like what prompted you to give this ranking? And then finally strategize, like what do you have at your disposal that helps you, what impedes you, and what is needed? And so the first time that we did this, this is what we found. So an ideal world would be that these pies were the darkest color, but you can see that there's a ton of variability. There was people in the OPHO in 2022 who'd never heard of the Truth and Reconciliation Commission calls to action.
And can I pause and interrupt for one moment, even though I said we weren't
Of
going
course.
to But so some of you may be doing a bit of a mental exercise right now for yourselves. And we often will pause to acknowledge those folks who had the courage and the vulnerability to say, like, I've never even heard of this thing. Because it actually takes a lot of humility to be able to like acknowledge where you're starting from. And so we always take a moment to say thank you to the people that shared and were willing to share, like, I don't know this piece of work yet, and honor that growth mindset because we're all starting from someplace and the naming is so important. Okay, back to you, Kate.
And I think Kirsten can add, we directly responded to the fact that there was that variable knowledge with a essential training series, and Kirsten has made a workshop package or a toolkit for doing that. So she's going to put it in the chat. But when we did our qualitative findings, we learned from people's responses that starting the conversation with groundedness in love and care, and recognition that this is our work to do brought a sacredness to the work. That starting conversations not from health disparities, but from inherent rights really changes the conversation. Then we also learned about the status quo. So the status quo tells us there's colonial knots in every nook and cranny of our public health system. There is also variable knowledge about the solutions that we've been provided to address them. And then we also learned 3 things about like ingredients that are required. We also learned that asking people to do this without support, like to do it off the side of their desks is a challenge. So actually having dedicated time during work hours to do the work is important. And then finally, people recognized they were like, I didn't learn how to do anti-racist public health practice in school. I didn't know about the foundational obligations in school. I need clear guidance as I begin to strengthen my muscles in this area.
Thanks, Kate. Friends, I have had all my caffeine today. I had my espresso, I had my kombucha, but I have forgot to say a couple of important things. And when Kate was talking about operational support, it brought up 2 things for me. Having Kate with us, like sitting shoulder to shoulder with me for 2 years as a white lady who's very committed to this journey, disciplined about it, and like a few steps ahead of some of our colleagues was so helpful. So people really valued having Kate there to bring their vulnerable questions to. And we wanted to mention that at the very beginning. We will have time for some Q&A at the end. I know not everyone will be able to stay for the whole time, but we really wanted people to feel comfortable and safe in this environment to bring forward questions that maybe you've been holding back because you're not sure on. This is a very good place to bring that. The other thing I just wanted to say, going back to that copper pot basket metaphor, is that one of the problems with that Indigenous health title is that it often sits and rests on the shoulder of like one person in a team or a very small team in an organization who kind of dangle off the end of an org chart. And every so often, the big, huge behemoth organization looks over and they're like, oh, have you fixed our racism yet? Oh, no. Okay, get back to work. So this work and this research that Kate led for us in the office was really helpful with that inky pinky piece of clear guidance to understand that we all have ways that we can be contributing, and that as copper pot humans and organizations, there's very specific work that needs to happen. So thanks for letting me kind of backtrack there. And then we're going to move into talking into that third piece of ACT and share with you a little bit about our Unlearning Club as one intervention, and then we'll share one other tool. Kate, did you want to speak about this?
As I shared, by the time I got to being a PhD in epidemiology, I had one course, an elective in Indigenous health, and that was it. And so we recognized that most of the human beings working in the health system have not yet received like deep training that would help them to address the in plain sight report and others. And so we decided we needed to do a bit of unlearning alongside of our undoing, which is where we wanted to spend the most of our energy. And so we offered a chance to spend 17 months, and that's not a magic number. It was like how many months were left in my postdoc, doing kind of a version of a book club where each month we would read or watch a different thing created by Indigenous, Black, and people of color experts. And then we would meet to spend 2 hours discussing that and how we could take the lessons from that and implement it in our work. And 70% of the humans in our office said yes, they wanted to do it, including Bonnie. Bonnie did more homework than any other human. She showed up in
And this
during
makes
the
Kate seem
pandemic.
like she's like kind of like low key, just like dropping names, but she is referring to Dr. Bonnie Henry in case there's any folks that are like into Dr. Bonnie Henry. But yes, she was,
Yes.
and it continues to be a totally enabling leader.
Yep. Yep. And so I know that there are people who invited us here today who have done their own version of the Unlearning Club. And so this was an awesome way to just like build our muscles and our skill as a collective. And we've put info online about that.
Yes, I just put it in the chat, I think, to everybody. I'm going to try and share this story very quickly about this next tool that we want to share with you, which is Colonial Knot Review Tool, or also we call it the Control F protocol. So this ties back to that, the weight that's carried when you are labeled with that Indigenous health title or team. And so when Kate came to join us at the office of the PHO to do her postdoc fellowship, she spent a lot of time shadowing me because, as I said at the beginning, we didn't really know how to do this work. And so one of the things that she clocked was that I would get these emails that would come into my inbox, and it could come from somebody in my team. It might be somebody external to my team. And it would be for a request to review a document or a policy or something that somebody was working on and provide like Indigenous perspectives. And so the most generous interpretation of that ask is that team members recognized, oh, this is really important. We need to be thinking about including Indigenous perspectives. And the least generous interpretation would be that folks had done no work. So it ended up actually being quite a big ask for me to look at these different documents or policies. And it would be, Kate would say that she could see it on my body actually, because it would be like a deep sigh and sort of a heaviness to realize that, oh, my colleagues had recognized that this work needed to happen, but had not taken it any further. And so it felt like quite a heavy weight on my shoulders then. And so what we did together is put our heads together and tried to identify what were the patterns of the things, the elements that were missing. And what we developed as a result of that is the Control F, or the Colonial Knot tool. It has these two names. And the things that we realized were missing was starting with self-location. So it's really important to start by acknowledging and naming one's own orientation or relationship to the territories that you're on, and what it is, the lenses and the unearned advantages or disadvantages that you might be bringing to whatever it is that you're working on. Recognizing the inherent rights through a distinctions-based lens, upholding foundational obligations to Indigenous peoples, so actually naming the life-saving directions or solutions that have already been directed by First Nations, Métis, Inuit people, daylighting Indigenous-specific racism with a few different prompts or questions, and then, as I mentioned at the very beginning, considering intersections and other systems of oppression that are at play and actively causing harm. And that resulted in the Control F protocol. I'm not quite sure. There we go. Sometimes I'm needing to double click, but This is something that exists on our website again, and I actually go back to this probably once or twice a week at a minimum. And I find it so helpful because you can open a document. We work in public health, so we work on a lot of policy and that sort of thing, recognizing there's a lot of sort of individual patient care clinicians on the line today. Another place where it's quite useful to apply this would be when you're doing your critical appraisal of different evidence, when you're going to journal articles. And what you can do is just open the article and just literally go through and hit Control F. Find window comes up, and then you can search these terms. And as you search these terms, you're looking for different patterns. And the patterns that you're looking for, these are common patterns that we find, again, in our own documents. We're always doing this work on ourselves first and looking at our own work. So it's not about pointing fingers unless we're pointing at ourselves. So we're wanting to create a discipline of making sure that we're not erasing or invisibilizing First Nations rights and title or other Indigenous rights. This is so common in public health, and I think in healthcare in general, that the problem becomes mislabeled. So indigeneity is not a risk factor, but in the way that we report out on statistics and findings, we conflate risk with our identities. So right at the beginning, Kirsten was sharing with us these totally heart-wrenching truths that First Nations people in BC have a much shorter life expectancy than other residents. But to be clear, there's nothing about being Dene that is inherently risky. What confers risk on us is being subjected to Canadian colonial practices and policies. So that's a very common finding. Paternalization and stereotyping is still very common in our discourse and in our literature. One pattern that we found in our own work is that we would start off really strong and acknowledge Indigenous rights and acknowledge First Nations rights and title holders, but we didn't quite have the muscles to pull that through in a substantive way through the whole document. So that's something we're working on. Another thing that we've done is not upholding distinctions-based approaches. And so an example of that in our own work is we have good relationships with First Nations Health Authority and with Métis Nation BC, and we have collaborative reporting relationships with them. And even though we've talked a big game about being distinctions-based, we have still not ever published anything with Inuit living in BC, and we're going to do that in 2027, I think is our timeline. We're working on a child and health youth report refresh. This is so important, and we have contributed to the erasure of Inuit people, and we're just starting to correct that. And then the last pattern that we see happens often is kind of this blanket application of EDI, where there's a conflation of Indigenous rights holders with other equity-seeking groups, which kind of loops back and is a bit of a way in which that settler colonial narrative gets upheld because it erases the distinct relationships to rights holders of these territories that are currently occupied. Okay, I'm going to speed us along. I slowed us down. Yes, do you have something else to add, Kate?
We have 7 more minutes.
Yes.
And like 10 or 15 slides. So perhaps
fast.
Okay.
I was just going to add something really quick to this slide, is that for the frontline healthcare providers on this call, this process is long. It is actually really fast. Like it sounds like it's like this big arduous thing of control Fing these, but you will find what you need, what you're looking for within like minutes. So it's really quick, max 5 minutes. Yeah.
Thank you, Kirsten. That's so important. And we do have 10 slides, but they're all closing slides. So it actually goes pretty fast. But thank you, Kate, for the time check. So I'm not sure because we went through it a little bit quickly, but the title of the presentation is Fix Ourselves. That's what we're endeavoring to do. And so that actually comes from a quote. Now we've just learned that it's a quote from a quote. So we attribute it to Jody Wilson-Raybould because this is from her text in True Reconciliation, but we now understand that these are words that were shared by the late Senator Justice Murray Sinclair. So what we are being asked to do, one of the things I make sure non-Indigenous people understand is we don't need you to help heal us. We need you to fix yourselves. We need you to get those people out there who are perpetrating this process of working against reconciliation under control. We need you to straighten yourselves out. We don't need you to just step forward and say, well, here's what we can do for you, because my question is always, what are you doing for yourself? What are you doing to get rid of that violent vocal force that is holding us all back, holding us all, holding this country back? Because that is what's going to stop reconciliation. And that's very urgent work because we actually know that there are very violent vocal forces that are at play. So the beautiful, Honorable Senator Murray Sinclair, again, a work from Kent Monkman, this beautiful portrait. We have described for you a mountain. We've shown a path to the top. We call upon you to do the climbing, the copper pot work. And so going back to Dr. Becky again, who talks about repair as the most powerful strategy, we have edited the quote. So rather than referring to parenting, we're talking about allyship. So good allyship isn't perfect. Good allyship repairs. And so how do you do that? By pursuing connection, acknowledging the impact your action has had on others, regardless of whether it was intentional or not, and then talking about what you're going to do differently next time. So the bumpy road to repair, or again, truth and reconciliation, we can travel down a bumpy, hard road when we have the conviction that it's going to take us where we want to go. There's a road that's familiar and comfortable and that doesn't create discomfort. The problem is that it's taking us to a place we don't want to go. Notice the urge to drive down the smoother road. That makes sense because it's easier in the short term. The road to repair is bumpier and it takes me where I want to go. And what's better than hoping for no bumps is feeling equipped for when the bumps inevitably arrive. And so I'm going to pass it to Kate just to talk about our very last and final bonus metaphor, a third one. Thanks, Kate.
Jody Wilson-Raybould, she tells us that it's not a sprint we're doing or a marathon. And we talk about building our strength, our stamina, and our discipline rather than being perfect all the time. And one of the things I think about is when I start a gym program and I get going, it can be so painful. My muscles are sore. I don't want to return to the gym right away. I want to rest and rest and rest and rest. But we know that actually consistency is the best thing. And you'll get through the pain of going to the gym. So it's not so much about doing a blitz, like going to a webinar today and then not doing anything for 2 months. It's about making a plan to go to the gym and stay at the gym and keep showing up in that way so that our muscles get stronger and that they stay strong.
So this is our invitation to you to join us at the Fix Yourselves gym, which we are avid proponents of. And so with that, the final slide is just a full color picture of what I consider to be the most beautiful embodiment of true reconciliation. So this is some of my family. That's my dad in the orange shirt. He's a survivor of Lower Post Indian Residential School, just celebrated his 75th birthday this year, which is a milestone. My kiddo with the red backpack, and this is us walking on the beautiful boardwalk to the Liard River Hot Springs. So we're still here. We are still here, and we want you to join us at this gym so that we can all flourish together. So we will pass it back to you, Dr. Ho. Thank you so much for having us and letting us share a little bit about our work.
Wow, this is amazing. Danielle and Kate and Kirsten, thank you so much. I love the content. I love your authenticity. I love your dynamism. It's just walk us through all that with such a great insight. So really appreciate it. I know that some folks may need to leave. Thank you so much for joining us. We're going to put up a link. If you can give some feedback, that'll be fantastic. I'll be going to the Q&A momentarily within about a minute. I just want to reflect on a couple of things that you said. Is just absolutely amazing. And I also wonder if Elder Glyda, if you'd like to make some comments, I'd love to also invite you to do so. But the fact about the unlearning, and we learn, but we make mistakes. It's good allyship. It's not perfect. And also the fact that learning means discomfort and bumps. I think all those makes huge sense. So really appreciate all that. And I love the metaphor of the birch bark bucket and the copper pot approaches to look at two complementary but also different body of work. So those are really metaphors that are really sticking in my mind in a very positive way. So thank you so much. Elder Glyda, I first like to invite you for your wisdom to share with us and your thoughts on what was presented. Elder Glyda?
Can you see me? Oh, there I am. Hello. Thank you so much for your presentation. Can you hear me? Oh, great.
Yeah, we can hear you.
Thank you so much. Always so interesting to hear all of what was discussed here. I love the net metaphor. I love the way that was presented and how it looks during the day and how it can look at night. I think that is so bang on important. And having everyone to, I do believe that it was mentioned to do some personal research, and we're not carrying the load, if I can use that language, and inviting people in a good way to read some of the things that were talked about today is also important. And even saying and naming racism and white supremacy, and it's been a long time coming that we're able to share about the truth of the matter. And I like how you explained I am Sa'aman, and I am so honored to be Sa'aman and grateful for my ancestors, and that's who I am. It's not the statistics that are describing me. That is so important. And for all of our Indigenous people from all across the Lower Mainland and all of our Turtle Island, everywhere, we are people, we are Indigenous, we have teachings and knowledge and systems that you're talking about and sharing. That is so important. The way that it was shared. I love this presentation, and I'm looking forward to watching it again, and I would love to share it far and wide if I had the power to invite you to different places to share it. And I think that it's so important, and the work that you're doing. Thank you to all the presenters, and it's always my pleasure. And I'm looking forward to the future and to hearing the feedback, and for the ones that are going to be filling out the what do they call it? Survey? Is it a survey? Call it a survey, right?
Yes.
Answering the questions all about what they witnessed here today. And I hope everyone took notes, and I know I'm looking forward to learning more about what was presented here, because I love the approach, and I love to share about that. So I thank you, everyone. Emotes again. Thank you. Thank you.
Thank you.
Masicho, Elder Glida, you invite us anywhere and we'll come. For sure.
Thank you.
Excellent. Thank you so much. And also for everyone, just a reminder, thanks to our speakers. They allow us to be able to record this session. So in about 2 weeks, we will have a link that will be able to have this presentation. And of course, this is just a small chunk of your work. And we'd love to welcome you back to share more, and also others, if you're interested in contacting our speakers. Maybe if it's okay, our speakers, I can pass that on to you in case they want to invite you to other presentations. In the meantime, let me start the Q&A. I do know that there are good Q&A questions we'll get to for sure. There was a comment in the chat. Doug, thank you very much for asking it. That was about the fact that the comment is colonial governments not following the colonial government rules. Is that also a version of white supremacy? Very thoughtful question there. Thanks, Doug, for asking that. I wonder, our presenters, what are your thoughts on that particular comment?
I feel ready to say my reflections about it. That okay? I'm
Please.
doing my practice of deferring to Indigenous voices first, but Danièle did her nod. So I think this is so important. And one of the teachings that Danièle has shared with me is like this question to ask of like, what do we need to do more of, and what do we need to do less of? And I think for me, that is so helpful in this work to eradicate Indigenous specific racism and white supremacy. Like, one of the things that I see my colleagues do is we love to create a program. But we can't program our way out of this. And so I think we need to like be disciplined about definitely asking, what do we need more of, but also what do we need less of? What do we need to stop doing that we're currently doing? And as your comment came in, the other thing I was thinking about was in the In Plain Sight report, they made these, I think, really powerful links between sort of stereotypes that are prevalent, and we can hold stereotypes. Or we can inadvertently uphold stereotypes, even if our core belief is that they are untrue. We can still, through our socialized self, enact those stereotypes, even if like in our head we're like, that's totally not a thing. And I think Kirsten speaks to this so beautifully about clinical practice. But I was thinking about the In Plain Sight report from the SANYES data shows people can hold stereotypes, and then the result of that is like a number of different things that happen in clinical settings. And one of those is deviation from protocol. And for me, this is most vivid, the Keegan Combs case study. So when he came in, he'd inadvertently consumed windshield wiper fluid. And immediately when he came to the ER, he had blood work that, had it been recognized, he had a wide anion gap. And I don't know what that means, but maybe somebody on the but that was not acted upon until like almost 24 hours later, when his GC something score GCS maybe, had gone and he was no longer conscious. Um, and so there was this instant of deviation from protocol, which was like sort of this passive way of upholding Indigenous specific racism. So I totally agree with your comment. And I didn't answer it directly, but it made me think of those two things, like what do we need to do less of? And also in what moments am I deviating from protocol? And that's actually upholding white supremacy.
Thank you, Kate. And just while you were speaking, that made me think of two other things as well, which is um, this the assumed exhaustive jurisdiction of the Crown. So, like, there's actually this embedded, widely normalized belief that there is like one set of rules and one set of laws that are like the law or the rules that are created by settlers. And so, as Kate was talking, it reminded me of DRIPA and talking, so the Declaration on the Rights of Indigenous Peoples Act, which is really meant to make visible legal pluralisms that actually before Europeans arrived, and still to this day, we have our own Dene laws, Pla'amin laws, Wet'suwet'en laws, and they are still very much in force over our territories, but they've been sort of run roughshod over by this assumed exhaustive jurisdiction of colonial laws. And so one of the things that we've noticed is that it can be really, I'm not going to say easy, but it can be easier to sort of stand sturdy in your conviction to advance true reconciliation when when First Nations laws align with like what settlers want to do anyway. So an example of that for us was during COVID-19, and when what the First Nations leaders wanted to do in response to COVID was the same as what Western Public Health wanted to do. It was like, yes, let's absolutely hold up First Nations rights and title. But then when what First Nations leaders wanted to do was did not align with sort of Western public health approaches, there was more distress and a more difficult time to say, like, yes, I stand behind First Nations leaders. An example of that was lockdown. So a lot of First Nations communities wanted to restrict movement in and out of the community. And that comes from a place of really prioritizing the well-being of the collective and elders and cultural continuity over sort of individual freedom of movement. So that was an example of a clash. So I think those were the thoughts that came to me while Kate was speaking.
Excellent. Thank you very much.
Oh, and maybe I'll just
Yep,
say, I think we're okay.
please.
The slides can come down from my perspective. That's fine if you want to take the slides down.
Yes, I think that
There
would be
was
a great idea. Yes.
There was an audience member who wanted the Control F protocol, and I just want to say to that audience member, Kirsten has made it all available on the internet. So I've just put a link to that too. So that information is all online, and that's the one that we go to that and we're like, okay, we got to do this for our own writing. And so thanks, Kirsten, for that.
Fantastic. I'll go to Q&A now. And the first question actually is a great transition from what Kate said. Thanks for Anonymous. You'd like to save the chat because of privacy. Unfortunately, you won't be able to do that. But what we will do is all the links that are put into the chat, we'll put into a new document and we'll send it to everybody who participated in this round. So you have the links so you can click to it to get to that. So, okay. The next question, Elnas, thanks for asking this. I wonder if it's a bit of a case study. How do all of this link to the opening slide, which about toxic drug crises and the stats about among women being higher? How do you link what you do to those type of situations? Welcome your wisdom on that.
Yeah. Oh, thank you for that question. Sorry, team. Is it okay if I jump in. So this really makes me think of when I joined the office. I've been in this office for 10 years. And one of the things that we were working on when I first arrived was reporting out on First Nations statistics with First Nations Health Authority. And there was about 7 indicators. They were all quite downstream, like life expectancy, infant mortality, youth suicide rate. And in 2015, shortly after the creation of the First Nations Health Authority, Joe Gallagher was the CEO at that time. And Joe directed our team, which is Office of the PHO and Office of the Chief Medical Officer at FNHA, so 2 sides. He said, we absolutely need to shift what we're reporting out on because we're just looking at these downstream indicators, and we need to be more holistic and link what we're tracking with the First Nations perspective of wellness. And so maybe Kate or Kirsten could find that PHWA and add it to the chat as well. But we looked at an ecosystem of wellness, and we looked at the deepest roots of First Nations wellness being self-determination and legal pluralism and our rights, which are embedded in our lands and waters, connection to land and water. We saw in the shallower soil all of these different Western settler systems that we need to interact with in a good way to get our needs met: housing, education, food security. And when all of those needs and that soil is well nourished, so it's free of Indigenous-specific racism and white supremacy, and we can fully be ourselves, then we flourish in mind, body, and spirit. And so I love this question because for me, that brings me back to this very daunting situation that we're in, which is the reality of this huge drop in life expectancy that we've seen for First Nations people. And so when I look at that finding, it like literally rocks me because I have 8 family members between the ages of 18 and 64 that died in the period of 2017 to 2023. So many of them are actually in the data that gives us that number. So this work and what we've described from the first opening slide to the closing slide for me is exactly that connection. It's my plea and my call to action to people to be like, this is such urgent work. Like, whatever your role is, whether you're an emergency physician, a dietitian, a clinical nurse manager, like whatever your role is in the healthcare system, even if you feel so removed from the toxic drug crisis, the reality is that our numbers are so stark in that crisis because of all of those colonial knots that keep that net in place. And so each and every one of us, regardless of what our role is, even beyond the healthcare system, just as an occupier, a settler occupier of unceded First Nations territories, if we are not being disciplined in our day-to-day personal and professional lives of making things right, then we are insidiously holding up this net, and we are contributing to these early deaths. And this, for us, like for my nation, it's an existential crisis. We have only a handful of people that speak our particular dialect of Dene, of Slavey. And so it's so urgent when I think about my family members, my cousins, my brother, my auntie. We can't afford to lose any link in that cultural continuity chain. So I don't know if that helps make it more clear. I hope it does. Basically, what I'm trying to say is that whatever your role is, whatever it is that you carry out in your day-to-day professional life, you can contribute to making these life-saving directions and solutions a reality. And ultimately, all of that work together is what's going to shift these really downstream indicators and outcomes of things like life expectancy and deaths to the toxic drug crisis. I'll pause just to see if my colleagues can maybe add some clarity.
Absolutely. Well, you're very clear. I also welcome Kate and Kirsten. Any comments?
Just affirming everything that Danielle said, and I wanted to pick up a thread that the question asker asked about the gender component. And so when we did the foundational obligations self-assessment survey, that little survey that we did in our own office, and then also in every setting that we've asked it, the people have the least engagement with the 231 calls for justice that came out from the National Inquiry into Missing and Murdered Indigenous Women, Girls, Two-Spirit, LGBTQIA+. So as I would say, like, it's not a representative sample, but as a system, we have been stronger but insufficient at upholding the TRC calls to action. But like we've been really weak in our muscles upholding those 231 calls for justice. And the Section 7 ones are for health professionals specifically, and the Section 15 ones are for Canadians generally. And so, like, I would really encourage people to spend a bit of time refreshing their memory about what those life-saving instructions are in that. And I'll just add it to the chat.
Wonderful. Thank you. Kirsten?
Yeah, just one last thing, because you guys both covered it so much. Is that I think coming from like as a white lady healthcare provider, that slide to me, from what I understand, that First Nations Health Authority asked us also to add that in. And to me, that reflects that's truth. That's kind of like what we were saying when we think about truth and reconciliation. It's like as settlers, we begin to understand how all of these things that are seemingly discrete that we see in healthcare are actually all related. It's all related to settler colonialism. And that's what's caused a lot of these, again, to our eyes, seemingly discrete issues. But naming it, again, is like that first step to saying truth and then understanding how it's all connected and then doing our actions based on that. Like Kate mentioned in our foundational obligations, is going to those instructions and doing what we can do to directly respond to those. But yeah, that's all for me.
Love it. Love the naming and then trying to identify ways and then really forming that habit to do it every day, little by little, more and more. So I think that makes a lot of sense. Thank you. The next, so I know that unfortunately we don't have enough time to answer all the questions. We have 8 minutes left. So we'll commit to make sure that maybe speakers, if you're okay, maybe we can send some of those to you. Love to get your thoughts, and then we'll append it somehow. Will these slides be made available after the lectures, please? For the recording, you certainly will be able to see all the slides again. For our speakers, are you comfortable with the slides? Again, I know that some are, some aren't, so don't feel pressure one way or the other. Great, thank you very much. Larissa, thank you very much for your comments. Larissa is from Ukraine, and she's been reflecting on her experience as a Ukrainian who has lived under Russian colonialism. And so there are a lot of resonance with what you're saying. And so thank you for joining all these rounds since its beginning. Larissa has expertise in terms of water purification technology to support First Nations communities, and would like to improve access to safe and sustainable water solutions. In some ways, it's another kind of practical examples how to apply. What would be your recommendations to Larissa, how she might be able to help? Maybe I'll pass it over to you.
Thank you so much. And just honoring, Larissa, what you've been through, what you've experienced, and what your family is potentially experiencing if they're still there. When I was listening to Elder Glida's prayer this morning, I heard her inviting Creator and the ancestors to really take care of people that are struggling or hurting or suffering in any way. And that's part of our daily prayer as well. And I think about those parts of the world that are like really, really having a hard time. So just want to honor that. And what a cool area to have expertise in. Water is life. Like, this is a relative that we absolutely need to treat with the most love and respect and kindness. And we are not meeting that mark in so many different parts of the world. So yeah, I think, like, from my perspective, the orientation that is most helpful in that kind of copper pot orientation or as an occupier is to lead with curiosity and kind of going into places with that like open hand, like, these are the skills that I have, if they will be of use to you, without kind of the assumption that that the skills that you have are maybe what a particular community or nation is interested in or looking for. We actually had a really cool milestone in our office, which is that Dr. Henry appointed the very first Deputy Provincial Health Officer for Planetary and Water Health. And it was a direct appointment to Dr. Shannon Waters, who's a Hulk Aminum woman who's also a public health physician. So she carries these two types of expertise. And so she's been in her role for coming up on a year or over a year, somewhere in that role. Anyway, she is somebody that's doing really interesting work around being a good relative to water, and how can we structure our systems and colonial practices and policies to enable us all to be good relatives to water. So I would encourage you to look at some of her work as an interesting like entry points into that world of upholding First Nations rights to uphold the ultimate life giver, which is water. And then the other thing that came to mind was some of the work that Tsilhqot'in National Government is doing. And there's a report that they released last February called Nagwentled. And it's about the landslide that blocked their river and was threatening their salmon relatives. And that has a really like clear path forward in terms of the different roles we can all play and following First Nations leads around being in balance with our more than human relatives. This is when I think about that net metaphor, we talk about it often about how it harms us as First Nations, Métis, and Inuit people, but it actually harms everybody because we are the ones, and our elders and knowledge carriers are the ones that hold the knowledge and wisdom about how to live in a good way on these particular lands and waters. And by keeping that like kind of tangled up, it actually hurts all of us. Because we all depend on these lands and waters to nourish and sustain us. So thank you for that question, Larissa. And yeah, as I say,
Thanks for that.
yes.
We have 3 minutes left. I'd like to get to one last question. In the meantime, there are two comments. Kimberly, thank you for acknowledging excellent presentation about how to stretch our anti-white supremacy muscles, train them. Joseph, thank you for your comment about the important presentation, acknowledging this. Doug has another question. I recently been learning about the kinship worldview. This is something we as settlers need to learn and understand, take to heart, and act on. Your thoughts about this kinship worldview? Is it very similar to your copper pot approach? And welcome your thoughts there.
Can I jump in again? Sorry, friends. So this is Doug. When I was just a newly graduated physician, I got to participate in a documentary series about Indigenous healing and Indigenous plant medicines. And we traveled all around the world. And the first place we went was Wales and Ireland. And I had lots of people who were like, why are you going there? I thought you were learning about Indigenous plants and plant medicine. And I was like, I am. And I'm going there because I don't know anything about television production. And this is where they're sending me. So I'm going. going. But the reason I'm excited by your question is because I believe that this kinship worldview is actually like the natural law that has guided all of us since time immemorial. And in the last like 500 to 600 years, we've kind of gotten a little bit off track with this sort of settler dominion over and that Enlightenment period that kind of like leaned in so heavily on Western science and positivism, like that there's one right way, which I actually think is like takes us away from the knowledge and the ways that all of our great, 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 great ancestors lived. Like prior to the phase that we're in now, we all coexisted and lived in a balanced way, which to me, it's like wild when we think of that as being uncivilized, but now we live in a time of like weapons of mass destruction. And I can't imagine that that's actually like, it's just so unkind in like the most profound way of understanding that. So yeah, I love your question because I actually think it's a worldview that connects to many of us if we just kind of go back enough generations. Okay, friends,
Great.
I took
Thank
us
you.
to 1:30. Sorry.
Oh, it's okay. Kate, Kirsten, anything you want to add? Wow, wonderful. And momentarily, I'll be asking Elder Glider to see if she has any final words for us, words of wisdom to close this. In the meantime, I want to take this time to thank you, Dr. Danièle Behn-Smith, Dr. Kate Youngblood, and Kirsten White. Thank you so much for your sharing. It's just I've learned so much, and as you see on the comments, we're learning a lot. For those who didn't, my apologies for my weak moderating for not getting into your questions. I'll make sure that we try to search for an answer for you. With that, Elder Glider, thank you for being here. I want to pass it back to you for your final word before we close.
This has been such an amazing time. And I just want to again say thank you, Emote Squire, again, raising my hands to you, presenters, Danièle, Kirsten, and Kate. Thank you so much. And I look forward to the future, and I love the research that we can all do to further our interest in this important area, this important topic. And I love that water is so important. Water is life, and thank you for sharing all of that. Water is just so important, and so is this topic. So I send you all blessings, and to take care, do something kind for yourself, do something wonderful, be it eating goodies, dare I say healthy food. A salad, everyone. Lots of love to you. Thank you, Emote. Have a good day, everybody.
Bless you, Joe. Thank you.
Thank you very much, everyone. Have a wonderful day. Take care. Thank you. And hope you'll join us again for our next rounds. Thanks, everyone.
Emote.